I'm Caitlin. I'll be your nurse today. I'm going to do a head-to-toe assessment on you. Can you state your name and date of birth?
Sean Taylor Kinley, 7/16/85.
Okay. Do you have any medical history?
No, I had a hysterectomy.
Okay. Are you on any medications?
Yes, I take Zyrtec and Bethanacol every day.
Okay. Any allergies to anything?
No.
Okay. All right. Patient appears healthy and well groomed. She's oriented. Okay. And I am going to start by inspecting and palpating the skull and the head, just for any lesions or masses. There's none that I can see or feel. Okay, and then I'm going to test your messenger strength. So if you want to just open your mouth for me, okay? All right, and then can you smile, frown, puff your cheeks? Okay. Alright. And then I'm going to palpate your lymph nodes. So pre, post, circular, occipital, submandibular, submental, and supraclavicular. Okay. And then I'm going to palpate the carotid arteries. Okay, and they are +2 bilateral. Okay, and then I'm going to do your range of motion. Can you look right, left, up, and down? Okay. And then I'm going to put my hands on your shoulders and you just shrug up. Okay, and down. Okay, and next I'm going to inspect the eyes. Okay, and I'm gonna inspect the conjunctivar. Okay. Now I'm gonna test the red reflux, your eyes. Okay. Right, it is present. Okay. Just gonna test your pupils. Okay. Can you look over there at an object and then just look at me? Okay. And then do the same thing. And I'm gonna test the 6 cardinals of glaze. Alright, you wanna just follow my finger. Okay. Alright, and I'm just gonna inspect the ears. I'm going to look at the external for any lesions, any tenderness. No. Okay. There's no lesions or masses. Okay. And then I'm going to look in your ears. Peripheral membrane is pearly gray. Okay, and I'm gonna go behind you and repeat. Say 3 words. I'm gonna whisper them to you. You just repeat them to me.
Okay.
Cat, dog, house.
Cat, dog, house.
Okay, great. I'm gonna do, I'm gonna check your triangular, triangular. Can you just swallow it for me? All right, it is midline. Right, and I'm gonna move on to the nose. Nose. Okay. All right. Am I supposed to smell this one? Can you smell this for me?
Peppermint.
Okay. Alright. Septum is fine. Okay. Mouth. Okay. Right. Can you hold one side of your nose, sniff? Hold the other side, sniff. Okay. Alright. Okay, I'm gonna move to the mouth. Lips are fine. Moist. Can you just open up your mouth? Okay. The tonsils are absent. Right. Can you take your tongue and move side to side? Alrighty. And can you swallow? Okay. Alright, I'm gonna move to the back and lungs. So I'm gonna inspect the posterior. Take a deep breath. Right. They're clear. And I'm gonna do the interior. Alrighty. They're clear. Okay, and I'm gonna do the expansion of your chest. Can you just breathe? Okay. Alright, breathe again. Okay. I'm gonna feel on your spine. You just let me know if there's any tenderness.
No tenderness.
Okay. Alright. I am going to move to the cardiovascular, so I'm going to check your nails for any clubbing, discoloration. Okay, and then I'm going to check your capillary refill. Alright, it's less than 3 seconds. And then I'm gonna check your skin turn. Right. No signs of dehydration. Okay, and then I'm going to locate and palpate the PMI. Okay. Alright. And then I'm going to auscultate the heart. Aortic, pulmonic, tricuspid, and middle. And S1 and S2 is present. Okay, and then I'm gonna do your pulses. So I'm gonna do radial first. Okay, +2 bilateral. Okay, and then I'm gonna do a brachial. Okay, there, +2 bilateral. And then I'm gonna move down to the femoral, and that's right here. And then the popliteal. It's hard to find, but I'd say like a +1. And then posterior tibia. Okay, +2. +2 bilateral, and then the dorsal. Okay, it's +2 bilateral. All right, and then for a breast exam, each month you're just gonna either in the shower, in front of a mirror, just feel around. If you feel any like lesions, tenderness, discharge, just notify your provider. Okay. And then I'm gonna do the abdomen. I'm gonna look for any discoloration, none is present, symmetrical. And now I'm gonna auscultate the vowel sounds. I'm gonna start down here at your right lower. Okay. They are present and active. Okay, and now I'm going to light palpate. You just let me know if there's any tenderness. Was there any tenderness?
No.
Okay. I'm gonna do a deeper one. Any tenderness?
No.
Okay. And then I'm gonna percuss. Any tenderness when I did that? Okay. Right, you can sit back up. Alright, and I'm gonna do your lower extremities. Hair distribution is normal. No discoloration. Now I'm gonna check for edema. Okay. No edema. Alright. And then I'm gonna move on to the neuro. What did you have for breakfast this morning?
I had shrimp and grits.
Okay. I'm gonna tell you 4 words. You'll just repeat it back to me
Okay.
afterwards. Cat, dog, pen, house.
Okay.
Right, and where did you go to elementary school?
Kimball Elementary.
Okay. And I'm gonna check your range of motion. So if you want to stand up for me, you can just lean side to side, back, frontwards. Okay. I'm gonna, if you want to lean frontwards, I want to check your spine. Okay. No signs of scoliosis. Was there any tenderness?
No.
Okay. Alright. If you want to sit back down for me. Alright, I'm gonna do a sharp, dull, or soft. Alright, if you just want to close your eyes for me.
Okay.
Just tell me what this is.
Dull. Dull. Sharp. Sharp. Soft. Soft.
Alright, I'm gonna do the tandem walking test.
Okay.
Just heel to toe. Okay. Alright. And if you just want to stand and put your arms out and leg up. Right leg. Okay. That is the Lumberg test. Alright, and if you want to close your eyes and just put finger to finger. Okay. One of your fingers to your nose. Okay. Heel to shin. Okay. Now I'm gonna test your tendon reflex. Alright. And then I'm gonna have you test the hand grip. So you just squeeze my fingers. Okay. Right, and that concludes my head to toe assessment.